Southeast Radio's Business Matters with Carl Fitzpatrick.
Southeast Radio.
Well, following a career in nursing, Sasha Roche Kelly identified an opportunity to provide patients with relief from lymphedema. But Sasha, before we discuss wellbeing techniques, I would like to hear about your career as a nurse.
Good morning, Carl. Thanks for having us on the show. So my background is in oncology nursing or cancer care nursing with over 14 years experience both in the UK and here in Ireland. I worked in the oncology day ward in Wexford General Hospital for 10 years.
So talk us through the experience that you got there in Wexford General Hospital as an oncology nurse and how it prompted you then to start this business.
So my day-to-day work in the oncology unit allowed me to work with patients, oncology patients, providing chemotherapy treatment for following cancer diagnosis. And during this time also I encountered people who had developed lymphedema due to either their cancer diagnosis or post-cancer treatment. And this clients presented with say arm swelling after breast cancer or symptoms like heaviness, tightness in the area. And from this then it led me into the area of management for lymphedema, because I found that unfortunately the services for lymphedema patients is very poor, and it's very hard for people to access the services both in the HSE and privately.
So what is lymphedema?
Yes, so lymphedema is swelling, like say either in a limb, so an arm and a leg, or it can also present in face, upper chest or abdomen following, like say, a cancer diagnosis or from their treatment. So what happens is the lymphatic system in the area is altered, so this results in the collection of fluid. So people can experience things like tightness of their clothes, that maybe the sleeve of their jacket or their shirt doesn't fit and is quite tight. Their jewellery might feel a little bit tighter. They might have a sensation of a newspaper under their arm. Or similarly in their legs, they might feel that the leg is different and it's heavy. And
more broadly speaking, what is the purpose of the lymphatic system?
So the lymphatic system is the cleansing component of our body, and it's a transport system. So it carries vital nutrients and metabolic waste through the body to be either reused or to be eliminated. We're all aware of our lymph nodes as well. So our lymph nodes are the filter stations. So they help to filter out anything from our bodies that are not needed. So it's vital to have our lymphatic system working to its optimal capacity, and that's where the manual lymph drainage treatment comes into. For people who've had an altered lymphatic system from surgery, this treatment is specialised in the sense that we're able to help the system to work a little bit differently. We have to use different pathways. So it's a very gentle skin technique that we use to help the lymphatic system to work to its optimal condition.
And is MLD treatment covered by any of the health insurance plans on the market?
So manual lymph drainage is covered by health insurance companies. It's important that people check with their insurance company before they, if they're deciding to go ahead with manual lymph drainage treatment. A list of registered MLD therapists can be found on MLD Ireland, and this is the governing body for our profession. So if people are registered with MLD Ireland, then they are generally covered by the health insurance providers.
Another treatment which you provide is combined decongestive therapy, or CDT. What is CDT and what benefits can it provide?
So CDT it's an add-on really to the manual lymph drainage, and what it is that we use compression bandages after treatment, and the aim of this treatment is to reduce down the swelling of the limbs in order for correct compression garments to be fitted then. So it just it allows us to get the swelling down to its optimum level, and then for people to be able to wear the compression garments, then to be able to manage it, the swelling moving forward.
And are the benefits from these treatments recognised by the HSE, and have they provided you with referrals to date?
Yes, so the HSE do provide MLD in some hospitals, but unfortunately it's not a universal service that is provided throughout the country. So we would have people that would be referred from health providers such as GPs, practice nurses, and they would recognise the role that manual lymph drainage has in supporting their patients and reducing the risk of complications for them.
And do you think there's enough of awareness about these treatments in Ireland? And if not, what needs to change to improve awareness?
Unfortunately, there's not enough awareness about the role of treatments like manual lymph drainage. Again, like I said, the governing body that we're involved in, MLD Ireland, we're in the process of trying to raise awareness and education for people to access services. Unfortunately, when it is a private service, it is tricky for people to be able to afford it long term. So it's about getting it to be recognised as part of the healthcare service for people, and that they can have greater access to the treatments.
While you were coming from a medical background and operating a medically orientated business, the world of entrepreneurship can present its own unique challenges. So what was the biggest challenge that you faced with developing your business?
The fact of it being recognised as a valued service in helping people to improve their quality of life and their well-being. The treatment itself has only been around since the 1930s, so it's relatively new treatment. So it's about getting it recognised and also for people to understand the role that the lymphatic system in relation to our health and well-being.
And Sasha, as you're operating in a specialist area, do you plan to extend your service offering in the future?
Yes, well, we back in 2018, we set up another company called Lenoco, and this helps to supply mastectomy bras. So for people who've had a breast cancer diagnosis, we supply specialist bras and prostheses, and we also supply compression garments for people who are linked in with our service for their swelling, that they're able to access quality garments in relation to managing their symptoms.
And I'm conscious that many of our listeners are sitting at office desks for 40 hours a week, or indeed many of them now, of course, working remotely and doing that, so they don't even have the benefit of travelling from the car to walking across to an office in the morning and evening. So in that respect, what particular ways can they support their own lymphatic system?
Yes, so our bodies, our lymphatic system doesn't have its own pump, so our bodies are designed to help our lymphatic system to work properly. And this is something that I saw a lot of recently is people coming in with issues and like that, assessing them that, you know, their lifestyle maybe has got a little bit more sedentary, they're not moving as much, maybe they're working longer hours. And also just trying to manage working from home. So what we encourage people to get up and move as much as possible. So we talk about movement, so it's to get our muscles contracted. So we would encourage people that every hour, if you could get up and move for 2 or 3 minutes. And then the other thing is about practicing some deep abdominal breathing. So the deep abdominal breathing is when we breathe from our abdomen. So this can be a great tool because it can allow people just time out as well, just time to sit and breathe and concentrate on it, and you know, maybe make yourself more aware of where you are, and it can also help to reduce stress levels, and it can help you then with concentrating on tasks ahead.
Well, if you've just tuned in, that was Sasha Roche Kelly from Wellbeing Techniques, and I'd like to wish her continued success with her business.
Southeast Radio's Business Matters with Carl Fitzpatrick.
Southeast